Dais and dear friends, comparison of target refraction with optical versus immersion biometry with Ladi method using Barrett universal 2 formula after phacoemulsification with premium ions. This is copyrighted method, there is no financial interest. Aim is to integrate immersion ultrasound A-scan biometry with modern formulae like Barrett universal 2. Advanced formulae require axial length of optical biometer. Need to integrate immersion with advanced formulae. Barrett universal 2 formula is suitable for all axial lengths. That's why it is used in this study. It's a prospective randomized study approved by ethical committee. Study followed the tenets of Declaration of Helsinki. Informed consent was taken from all the patients. Patients above the age of 40 years ready for a follow-up up to 6 months were included, and vision-threatening complications of the eye were excluded. Masking and randomization, immersion group 100 patients, optical 100 patients. Randomization codes were done by statistical analysis software. Study coordinator revealed the type of biometry. Operating surgeon, optometrists, and counselors were masked. Continuous variables, group differences, normality of distribution, best corrected visual acuity in log MR, categorical variables, group differences, univariate and multivariate linear regression analysis, outcome, and standard data with p-value less than 0.05 was considered statistically significant. All analysis was carried out as per protocol. Mandatory parameters of Barrett initial 2 formula were used. It is axial length, antechamber depth, keratometry. Optical biometry group, axial length, antechamber depth, and keratometry group taken from the optical biometer, while from immersion, axial length was taken from the ultrasound, while antechamber depth and keratometry was taken from the sham fluid imaging. In Ladi method, 200 micron was added to the immersion ultrasound axial scan. Ultrasound cannot penetrate internal limiting membrane, while optical goes up to retinal pigment epithelium. The distance between these two is 200 micron. As per the study, foveal thickness is 212, while central foveal thickness is 182. So average for the study was taken as a 200 micron. Both optical and ultrasound parameters were entered into the Barrett universal 2 formula. Study target was kept as a 0, except for EDOF patient. All variables, age, gender, visual acuity, and types of cataracts were almost same in both ultrasound and optical group with no statistical difference. IELTS were used where monofocal asperic and a variety of multifocality IELTS were used almost same in both the groups. Visual acuity, spheres, cylinder at 1 month, 3 months, and 6 months were almost same in both the groups, and both the groups attaining target refraction in 73% patients. The Lovis diagram shows that target was achieved very well except for the extremes of the axial length. The group difference was only 0.2 diopters. Exact target refraction was 73% in both the eyes, while 0.5 diopter was 94 in ultrasound and 92 in optical, but not statistically different. Spherical equivalent, residual refractive error, both were within the range, achieving the target. No statistical difference. Ladi method of axial length effective with Barrett universal 2 formula. Caution should be maintained at extremes of axial length. As per the previous studies, optical biometry is more accurate than immersion ultrasound in calculating axial length, but that values derived from both these machines may not be used interchangeably. After this study, Ladi method with ultrasound derived axial length is enhanced by 200 microns, appears to overcome this problem and provide refractive outcomes comparable to optical biometry. Drawback, this is not studied with swept source optical biometry, but even in swept source, in white mature cataract, you cannot get the readings. Advantages, randomized study, adequate follow-up, relatively good numbers. To the best of our knowledge, there are no studies looking at masking or making US-derived axial length compatible with the new IL calculation formula like Barrett, Olson, Hill, RBS, and Kane. In conclusion, Ladi method adding 200 micron with Barrett universal 2 formula is comparable to optical biometry. Further studies with larger sample size are needed with other formulas for widespread use of this technique. These are our references. Thank you.
Excellent study.
क्या हो गया इसका? अरे?
Sorry. Yeah, that's okay. Excellent study, Dr. Larry.
Thank you.
But majority of the places where people use ultrasound, they do not use topographer to do the keratometry.
So in this study, it is used as a, from, you can say, topography. You can use automated keratometry, which is available in most of the machines. Only thing, it has to be shifted to or adjusted to 2 decimal points, like 41.03, 42.05.
Have you done
Then-
that?
But that is there, in topography, it is already there.
No, sir. I'm talking of keratometer, automated
I
keratometer.
have done it, it works well.
Not mentioned in this.
Not mentioned because it is not a part of the study, because it will get camouflaged.
Thank you.
Because if I take reading from there, from where to take the anti-jumbled depth? That's why both were taken from the same parameters. So that 3 parameters are not used in the same study. But if I tried it, it works.
Good study. But you
So you're trying
need
to basically compare the axial length from ultrasound vis-a-vis the optical diameter. That
Yes,
was the ultimate. That was the main purpose of your study.
Yes, sir. And we are saying that ultrasound is equally correct if you are using with the modern formula, so that is going to compensate for the posterior corneal astigmatism, and there is no need of optical biometer. Thank you.
Thank you very much.
That is immersion technology only, no?
Sir, sir.
With immersion, not contact.
No, sir, not contact. It is only immersion, sir.